Good morning. My name is Kathy Dre. I'm the Vice President of Advocacy for the American Lung Association in Illinois. Welcome and thank you for attending this very interesting and perhaps historical press conference. Today, this very unusual group representing diverse organizations from across the state stands together to stress the impact to the people of Illinois if our programs and services are not funded. Two things have brought us together recently. Number one, all of the organizations represented here today are unfortunately in the 18% of the state budget that remains unappropriated or unpaid. Obviously, this group does not include all organizations that are not being paid, and I want to stress that we did not intend to exclude anyone or to offend anyone. We just started making calls on Thursday, and we just, honestly, we all just met today. So this is kind of an unusual press conference. Some people couldn't make it. It was too short of notice. Obviously, some people could. But it's a very historic that even this group was able to get together in such a short amount of time. Number two, last Wednesday, WUIS released an article titled "Past Due, State Fairs Still On Despite Lack of Budget." And this article is in your press packet. The article states that even though the funding for the Illinois State Fair and the DuQuoin State Fair is unappropriated, the fairs will go on as usual. The fairs are in the same 18% of the state budget as the rest of our organizations here today. In the last month, we have watched 82% of the state budget be finalized, either through continuing appropriations, court orders, or being signed into law. All of our programs are in the remaining 18% that is not appropriated or paid, and our concerns regarding the budget have obviously escalated. Of course, state employees need to be paid. School needs to start, Medicaid costs need to be covered, etc. And yes, even the state fairs need to go on for all of the reasons that are stated in the article. There's been a large investment already. There is a positive large economic impact for Springfield and DuQuoin, and certainly it would hurt the fair's reputations if they were canceled, and they would lose credibility. It is logical that all of these entities are paid. It is logical that the fairs continue as they have for many years. But that same logic also applies to all of the programs and services represented here today. Some of the programs represented here today are large and some of them are small, but together we have an enormous impact statewide every single day of the year. The lack of state funding is crippling critical state services that the people of Illinois rely on. First, I would like to introduce State Senator Heather Staines, the chairperson of the Senate Appropriations 1 Committee, to say a few words.
Thank you. So I just want to make a couple of quick points on this. We know, and as we've been seeing this unfold over time with the lack of a budget in place, how much of our budget really is committed. Pension payments are required to go out the door. They're continuing appropriations. We see them getting paid. We see getting paid Medicaid, as we've been going through court case decisions on that Medicaid around children, it hurts access if they don't continue to get paid. We're seeing that around a number of other different court cases having to do with providing services for mentally ill, people with developmental disabilities. Much of our budget is very much set in stone and not flexible. So the burden of not having a state budget put in place now is falling on a smaller group of providers. The state relies on social service partners to deliver a lot of our services. That's a model that we've worked out over numerous years, and we are being horrible partners at the moment with these providers. And what I'm very concerned about is that we're putting at risk that whole infrastructure. It's not easily put back in place if it crumbles. Every single day, just about, I'm hearing from another social service provider in my district on what they're having to do to try to get through the fact that they don't have a budget. Yesterday, I met with another one who's now down at a small number of FTEs, are down 4.5 positions in their organization, and they're totally operating on reserves. They can only do that for about another month. They're going to then have to let go people who have stayed in their nonprofit, even though they've been solicited and constantly wooed to go to a big large corporate law firm to try to help people get citizenship. They've stayed in their local nonprofit because of the mission and wanting to help people who can't afford to pay lawyers to get citizenship to stay there and do it. If they lose, they'll never get them back. And this is happening over and over in every nonprofit. You can't just rebuild that infrastructure once it's lost. Childcare, we've been losing thousands of situations now where we have kids not accessing childcare centers right now. My district, we have hundreds of those alone, but it's statewide, and I know there's thousands. Again, these take up seats in small nonprofits, in small child care centers, all the way to the very big childhood centers that can maybe hang on for a couple months without getting reimbursement or payment for folks, but can't possibly do that for an extended period of time. And the small ones are going to be hurting much sooner than that. Today, we're going to be putting forth at least a federal funds budget. I sure hope we can get agreement on that. I've been talking to Republican counterpoints and the governor's office around it. The federal funds budget that we're putting forth is exactly in line with what Governor Rauner's budget proposal had been when he issued his budget in February. We're using all of his numbers on the federal funds available. Doing this alone will take that 18% down even further on what's not getting done in the budget, can help ensure that we're making payments for women and children programs, some of the early childhood programs, some of the assessment programs that we've been reading about in some of the media where schools don't know whether they can have assessments in place, and on and on and on, and low-income energy assistance programs that there's federal dollars for. Again, this is not the way to be running the ship. We know that. We need an overall comprehensive solution. I think we've certainly seen overtures on our part, and my caucus at least, to try to get to that and be a good operating partner and negotiate in good faith. But that doesn't preclude us. We need to get a budget. We need it now. We can't undo the infrastructure for all these social service agencies that we cannot possibly put back together, and we need to hold up the state's end of the partnership with all of these providers. Thank you.
Next, we will have a representative of each organization give a very brief rundown on the impact of their programs. In the interest of time, we will have each person introduce themselves and give a brief 2 to 3 minute statement. And I'm going to start. Again, I'm Kathy Dre, and I'm from the American Lung Association in Illinois. And we host the Illinois Tobacco Quit Line in our office in Springfield. It's open 7 days a week from 7 a.m. to 11 p.m. In fiscal year 14, the Illinois Tobacco Quit Line took 96,000 calls from residents of Illinois who wish to stop using tobacco products. It was projected to receive 110,000 calls in fiscal year 15, but was closed for 4 weeks due to what became known as the Good Friday Massacre. The Quit Line employs 27 full-time employees, many of which are highly trained medical professionals. Some of these employees are multilingual so that they can counsel the people of our very diverse state. The staff would be very difficult to replace. The Quit Line has a success rate, an unheard of success rate of 43%. In comparison, most cessation programs have a success rate of about 20%, and people who try to quit smoking on their own have about a 5% success rate. The Quit Line has over 500 partners statewide, including hospitals, medical clinics, local health departments, etc., who refer smokers to the service. Every state in the nation has a Quit Line. If the Illinois Tobacco Quit Line is not funded, Illinois will be the only state to not have a Quit Line. The Quit Line is funded through the Tobacco Settlement Recovery Fund, which is a result of a lawsuit between the state and the tobacco companies. The state currently receives about $250 million from the tobacco companies every year. This money was to be used to end the tobacco use and the resulting disease and death. Taxpayer dollars do not support the Illinois Tobacco Quit Line. Most important, the Illinois Medicaid program's total costs caused by treating tobacco-related disease is $1.9 billion, almost $2 billion. You want to shake up Springfield? More money should be spent to help smokers quit and to keep kids from starting to use tobacco products. It is extremely short-sighted to eliminate the funding for the Illinois Tobacco Quit Line when nearly $2 billion of our state Medicare costs a year are directly related to tobacco use. And the Quit Line is currently open. The American Lung Association has promised to keep it open as long as they can. Every single day we talk about closing it. I expect right now for it to be open through the end of August. But after that, all 27 employees will be laid off, and the Illinois Tobacco Quit Line will cease to exist. So next, thank you.
Good morning. My name is Bill Krieb, and I'm the director of the Leslie Bates Davis Neighborhood House. We're a 100-year-old United Methodist Community Center in East St. Louis, and we've come here today from East St. Louis to talk about the devastation that is causing the budget impasse that is causing so many of our families. We serve about 20,000 families every year. We employ about 250 persons from the St. Clair, Madison County area. And right now, because of the budget impasse, there are thousands of parents who are struggling to meet some of the basic needs for their children and families. Right now, we have enough revenue to last for about another month. If the budget isn't made, we're going to have to lay off about 200 staff within the next 30 days. I brought a couple parents with me who are going to specifically talk about two of the programs that are really having a devastating impact on the people in our community, and they'll introduce themselves.
Hello, my name is Fletcher Springfield, and I'm here about the Teen Reach program. I'm here today to ask the governor and our legislators to start working a lot harder to get the state budget passed before our children go back to school in a couple of weeks. The state budget has to get passed for our children to keep the Teen Reach program. As a parent in East St. Louis community, I know how important it is that my child have a place to go after school. My children have been a part of the Neighborhood House and Teen Reach program for the past year and has truly been a blessing to our entire family. I have been able to volunteer some time at the Teen Reach program, and I have seen firsthand how important the children become positive about this program. And they learn to grow and become more involved in the community through different service learning projects that the program actually provides. The Neighborhood House Teen Reach program is helping more than 200 children, youth, and families learn and grow in our community, and I know the Teen Reach program is helping thousands of children and youth in hundreds of communities throughout Illinois. The Teen Reach program has proven to be able to help children and youth better in schools, and I know that this is true for my children. The Teen Reach program and the staff are helping the children and the youth tackle tough problems and become excited about learning, especially in areas like math and science. The Teen Reach program also provides leadership training, conflict resolution, career preparation for all older youth that actually visit the program, okay? Thank you.
Hi, I'm Ronika McClatchy. I'm from East St. Louis, a mother of 7. And as you know, the governor said he was helping, to lift people out of poverty, and he is about helping people get jobs. The Neighborhood House has helped a lot of parents get jobs and are often out of the St. Louis community. Many of our parents do not get back over this side of the river until about 6:30, 7 o'clock. It is really important as a parent and as all our parents to know that our children have a safe place to go after school through Teen Reach program. I also want to ask the governor to please drop the freeze on the child care assistance and put the eligibility criteria back to what it was a couple of months ago. Again, we have hundreds of parents who have recently completed job training programs, who currently have jobs and can work full-time and be employed, but with the freeze on the child care, it's hard for them to go to work. On behalf of all the parents from East St. Louis, greater East St. Louis area throughout the state, I am asking the governor and legislators to please support the after-school and out-of-school programs like the Teen Reach program, and to lift the freeze off the child care assistance. Thank you, and have a good day.
Good morning. My name is Tom Hughes. I am Executive Director of the Illinois Public Health Association, and thank you, Senator Staines, for your leadership on this issue. I'm here today to represent the state's oldest and largest public health association. We have 7,000 members across the state of Illinois, and I'm here in particular today on behalf of local public health departments. We're the people who go out and make sure that your restaurants are safe and clean when you dine out. We immunize your children when they're born and again before they go to school. We run dental clinics for the underserved populations. We run WIC and family case management programs to ensure healthy moms and babies. We test and treat HIV and STD clinics while educating populations on how to avoid risky behaviors. We make sure that private sewage is properly handled, that indoor air quality is safe, and that lead paint is found, abated, and that the children that are affected by it are found and treated. We're among the first in line when there's a natural disaster or one that is man-made. We're also right now working with a mumps outbreak in Champaign at the U of I. So those are some of the things that we do. On July 28th, we surveyed our local health departments around the state to find out their financial condition, and what we found was disturbing, and I think that's in your packet. Right now, one of the things I wanted to discuss with you is Eastside Health District in East St. Louis has laid off 65% of their staff, and they serve a population of 65,000. Franklin Williamson, our Bi-County Health Department in deep southern Illinois, has laid off 17% of their staff. Effingham County is now going to a shortened work week with reduced hours. Cumberland County Health Department is now going to a 4-day work week. Every Friday, IPHA is convening all of our local health departments from around the state to catalog our diminished capacity due to the budget impasse. What we're asking for is that the leaders in the General Assembly and the governor come together to bring this to a close. But I will have to say this, and I've said this before in budget negotiations. Even if a budget were passed today, there's not enough funding to run a statewide system for public health. So we're also asking the leaders of the General Assembly and the governor to take a look at how we fund public health in Illinois. We think it's vitally important that this system be maintained. And Senator Staines, I would just want to say that you've been a remarkable friend to public health in Illinois. I want to thank you for that. Best of luck. Thank you.
My name is Al Ridley. I am a board member for the Illinois Partners for Human Service, retired executive director of the Illinois Coalition for Community Services. Thanks to Kathy for organizing this and to Senator Staines for making this forum possible. The Illinois Partners for Human Service represents 850 members who are actively participating as human service groups across the state, from Wisconsin line down to the most southern point of the state. In addition to those 850, there are probably another 500 to 600 who participate, allow us to advocate for them, even though they are not paying members. They participate in our phone calls. During the past few months, in fact, the past few years, we have devalued the human services area by accepting the erosion of vital services, not only to these groups, but in terms of how it's the most vulnerable. In fact, I would best describe this as a death march. This is where people are held captive and marched slowly to their point of death. Now, I'm not trying to be melodramatic here. I'm just simply observing the agencies across the state that I'm familiar with, which is a multiple group, of how they are attempting to survive and very close to death. The thing about that is intensified because that focused downward spiral and the erosion of those services impact the most vulnerable. In fact, the current activity that we see, or the current inactivity, is multiplied, which impacts many of these folks who are dependent upon or who live through human services. The complicating factor is that human services is an underpinning. It is foundational for jobs, for after-school programs, for education. It is like what holds a mobile home down or what holds a house down. And without these human services, then what we find is an erosion in many areas of family life. It is not only disgusting of the current affair and current conditions that we find ourselves, but it is very frustrating. Perhaps it's time to change our state motto from Land of Lincoln to "We don't care." It's still just 3 words. It kind of fits in. It would fit on the license plate, wouldn't it? And so whether we actually really believe that should happen or not, you're known by your actions. and those actions are consequential. And when they're held in terms of accountability, in terms of not only legislatively but executive-wise, we've come to understand that our current status in human services, at least with the Illinois Partner of Human Services, is bleak. And the continuation of many of the groups, as I referred to earlier, is highly questionable, but is multiplied in terms of those services that will not be rendered to whether it's children, youth, seniors, those who are developmentally disabled, or whomever would fall under that kind of terrible umbrella. So we at the Illinois Partner of Human Services continue to attempt to advocate and encourage in a very difficult time of bleakness in terms of where we actually are. Thank you.
Good morning. My name is Melvin Jordan, and I'm here representing ICCS, Illinois Coalition of Community Services. First, let me begin by saying it is essential that the Illinois Coalition of Community Services line item be included and kept in the FY16 budget. Just to the east of us are neighborhoods filled with poverty and uncertainty, a community within a community that is too often forgotten. I'm here today to speak about the poverty that has been imprinted upon my mind and heart, and how the Illinois Coalition of Community Services has implemented essential services that positively impact youth and families across Illinois. Not only am I a board member at ICCS, but I also run a summer food program. This is our third year, and I want to thank my pastor for allowing us to run this program at our church. I had no clue. I worked for the Illinois State Board of Education for 34 years, and I had no clue the numbers that I was tracking of poverty kids, of kids who don't have nothing to eat after school is out. When school's over, some of our children don't have food to eat, a hot, nourished meal. Sounds simple, but it means a lot when you're talking about a kid. Children, our children. Now, I'm not just talking about black children. We have white children too. We have got to take care of our kids. We can't expect someone else. This is the great state of Illinois. We're not Wisconsin, we're not Indiana. We're not followers, we're leaders. Thank you.
Good morning. I'm Dave Roth, and I'm a staff member at Lutheran Child and Family Services of Illinois, and I have with me Julie Mavick, who is a case manager in the LCFS Veterans Program in Decatur, Illinois. And I also want to express my gratitude to Senator Staines. LCFS has programs across the state. We serve about 40,000 folks a year. We serve in north, central, and southern Illinois. We have 27 offices and about 450 employees. One of those offices is in the Chicago Uptown neighborhood at Chicago Uptown Ministry, where we have 5 staff members. And I want to applaud Senator Staines for being very out there in the community to be assessing what's going on. And I appreciate that that results in great advocacy here in Springfield. So LCFS is a statewide organization, and with those 40,000 folks we serve a year, we enter into a relationship where we learn what's going on in the lives of our clients. And so we've had the chance to listen to them talk about what's the impact of the current budget impasse on them. And there are a couple of things that we want to highlight for you today. One of those is the impact on veterans who are in permanent supportive housing in Decatur, where Julie works. LCFS provides a case management service to those veterans, and the budget impasse has meant that the Department of Human Services, in its uncertainty, has issued a contract to LCFS for that service at half the amount of last year's contract. That means we must reduce the benefits and the services that we can provide through that contract. And one of the essential ones that has been reduced is transportation. Julie works with veterans who need to get to health care appointments, dental appointments, substance abuse treatment, job search activities, social activities, senior activities, you name it. And so we're working feverishly with those folks to find alternative subsidies. Some of them who are capable are walking more, but all too many of them are simply not getting the help they need because there's not a transportation benefit available to them. So that's an immediate harm that has come already. Now I want to talk about kind of the horizon, which has very dark clouds for us. We are a child welfare service provider in Illinois, and we have at any given time about 1,200 children in substitute care, foster care, residential treatment, emergency shelter. And it is those children that we work with to build a child and family team. That is a foster parent, a birth parent, a potential adoptive parent, to make a plan for that child's safe, permanent future. Those folks who are involved in that planning are telling us that they're very worried about the uncertainty. They rely on the services that you've already heard about, the Teen Reach service that was spoken of, daycare subsidies. They rely on mental health services, and the uncertainty around the impasse and the recently released report from the United Way that says the wave is going to hit at the end of this month and in September. That's when those services are expected to go away. What that does with that child and family team is freeze them. Their ability to move forward with finding the safe and permanent home for that child slows. And that gives us anxiety at LCFS because the one thing we know about successful child welfare practice is it must be swift. The longer a child is in substitute care, the more damage that can be done. And you might think, what's 3 to 4 months? What difference will that make? Well, in a child's sense of time, if you're 3 or 4 years old, that's all it takes to destroy your ability to trust for a long period of time. We don't want to make their lives more difficult. So we're urging everyone who has a hand, a voice, any kind of influence in the budgeting process to work toward a solution that brings adequate revenue, funds the essential services, gives us a chance to restore the benefits in our Veterans Program in Decatur, as well as to give assurance to the families who are involved in the child welfare system that they'll get the enduring support that they need. Thanks.
Good morning. My name is Vicki Smith. I'm the Executive Director of the Illinois Coalition Against Domestic Violence. I, too, want to thank Kathy for pulling us together this morning here in Springfield, and I want to thank Heather Staines for her ongoing efforts to try to figure out some solutions for our budget. My organization represents roughly 50 programs across the state of Illinois that do direct services to victims of domestic violence and their children. We provide services to over 40,000 adults and over 8,000 children every year, 24 hours a day, 7 days a week. What is happening now is that 24-hour service is beginning to collapse. We have one agency in southern Illinois that serves 4 counties that closed their doors Friday. The only thing that they're going to be able to do is they've transferred their hotline to Chicago, and they will answer extreme emergency calls. We have another agency in southeastern Illinois that will close its beds as of the end of this month if the budget isn't resolved. That agency covers 9 southeastern counties and provides services to homeless prevention, domestic violence victims, and elder services in that entire area. So with the reduction of those, you can see the impact across the spectrum of what's going to happen to many of these agencies. I also want to talk about the fact that in the last decade, human services in particular has reduced by about 30% in our state budget. When Kathy talks about only 18% of the budget, that's where the hits always come from. That's where the cuts always come from. All the time I hear about, we've got to make cuts, we've got to make cuts. Well, the human services field has made cuts for the last decade, and we're really beginning to collapse now. And as Kathy talked about earlier, if we really lose these programs, they will not be able to be replaced. They do multiple services to hundreds of thousands of people in this state every year. And it's not just one person using one service, it's a family using multiple kinds of services across the life spectrum. So it's really critical that all of our leaders sit down together and talk about real solutions so that going forward, we not only resolve the problem this year, but we have to resolve the problem going forward. We have been dealing with this for over a decade and have not come to the table with real solutions for how to help our families in Illinois. So I think, I can only echo what my colleagues have said coming in. We need adequate revenue, we need adequate spending, and we need a complete package put together to help the families in Illinois who need all of these services. Thank you.
Good morning. My name is Jim Runyon. I'm Executive Vice President at Easter Seals, Central Illinois, and I have the honor and privilege of being the Chairman of the Board of Illinois Partners for Human Service. Al has already spoken very eloquently about our statewide coalition, so I won't address our statewide efforts, but I do want to focus on very specific programming at the community level. For us in Peoria, Easter Seals serves about 28 counties across the center of the state, and we serve 7,600 families each year. Not all of our programs are at risk with this current budget impasse, but some of them are at great risk. And I want to talk specifically about our programming for children with autism. Russ is soon going to speak about the autism program. We are a part of that network, and we are the largest provider downstate of all autism services. Since July 1, we've been operating without a contract and without payment, or even a promise of payment at this point. And we continue to patch together different types of public as well as private funds to be able to continue to provide those services. But that cannot be done indefinitely. At some point, probably in September, we will have to lay off those highly trained professionals, and we will have to suspend services for many families, especially those served through Medicaid. The other major impact for us is we are one of the fiscal agents for a state contract for early intervention across the state. There are 25 early intervention offices across the state. I'm the fiscal agent for 2 of those that serve 11 counties, again in the center part of the state. I have 39 employees. We serve 1,600 families at any given time. And given the current impasse, we have a contract. I wouldn't go to bank with the number of dollars that are been placed inside my contract, and a promise to be paid back to July 1, but no idea of when we will see that first payment. So for organizations like mine, inside early intervention and many other programs, we're operating, as others have said, on our cash reserves. We're operating on lines of credit. But again, that cannot go on indefinitely. We will reach a point, likely for some right now, for others, August, later in August, Labor Day, October 1. And what you're going to see is this trickle become a stream, become a flood, as program after program is closed or suspended or access restricted, and more of our employees be laid off or terminated. Now I want to talk just real briefly about that, and then I'll close. For many of us, our employees are highly trained and very dedicated folks. So when we have to lay them off or we have to terminate them to try to restart those programs when they have moved on either out of state or inside state and found other jobs is incredibly difficult. For my early intervention program, if I have to terminate those employees and they leave, it takes me an additional 6 months to retrain and re-credential those folks. So we can't stop and start on a dime. This is much more like a freight train. And so we all see where this freight train is headed. So I especially ask you, my friends in the media, to be of help with us in sharing these stories, because my fear is that until most folks in most communities feel the pain of this, it is going to continue to be, in large part, ignored. And until it's too late, and then Once these programs have closed, suspended, employees have moved on, my fear is folks will begin to notice, and it will be too late. So thank you, Kathy, for today. Senator Staines for your assistance. Thanks.
Good morning. My name's Russell Bonanno. I'm the State Director for the Autism Program of Illinois. And as others have done, I would like to thank Kathy and Senator Staines for their support for setting this up this morning. I also want to thank members in both houses for the ongoing support that they've been providing to the autism program throughout its history. We're in a unique situation. The autism program is a collaboration of 4 public university programs and 13 nonprofit agencies across the state. We operate 19 centers specializing in resources, direct services, and training related to autism. Our funding has been decreasing over the years, while the number of children with autism has been increasing. In 2008, the CDC said that 1 in 88 children was diagnosed with autism. In Illinois, that meant a little under 23,000 school-age children, and our allocation then was $4.87 million. In fiscal year 14, the CDC reported that now 1 in 68 children had a diagnosis of autism. Autism is more prevalent than childhood cancer and pediatric diabetes combined. However, in spite of that 96% increase in the prevalence of autism in children, our budget decreased from what it was earlier, not because of anyone's fault, but because of the state of finances within Illinois. In spite of this, we've been able to continue to serve children and families. People hear that most of what we do can be covered through insurance and Medicaid. It's simply not true. Medicaid does not provide for autism services, many of the services of which we provide. Applied behavioral analysis is the most proven intervention for children with autism. Medicaid does not pay for that. Many private insurances that are either self-funded or ERISA plans do not pay for that. We provide that service at a decreased cost for those families who could not otherwise afford it. In addition, in many parts of the state, we are the only providers of autism services. Without TAP centers, there will be no services for children with autism in many parts of the state. We provide training to teachers. We help teachers in local school districts keep children with autism at home in their school districts rather than needing to send them to day programs or residential programs, significantly higher cost. That training is not covered by any insurance, it's not covered by any other state program, and we don't charge the local districts in order to do it. We've served over 5,000 families, teachers, and others through our resource rooms. The only funding for those resource rooms comes from the state. 2,800 teachers, parents, and other professionals have received autism-specific consultations to allow them to better serve children. That is not paid for in any other way. 8,690 teachers, first responders, EI professionals, medical and behavioral health providers have all received training without cost due to the funding that we have available through the state. This will all stop. In addition, we do provide a significant return on investment to the state of Illinois. We have brought in over $34 million in federal and private foundation funding for use within the state as a result of programs funded by TAP, as a result of the foundations established by our TAP centers. This is virtually a 100% return on investment for the money that the state has invested in our program. The budget impasse is already impacting our citizens, our clients, and our staff. TAP at CTF Illinois, which serves a significant number of counties in the eastern part of the state, closed on July 1st, laid off 100% of its staff. Easter Seals Chicago and Easter Seals Rockford laid off 50% of their staff. Those centers, in addition to direct services, train pediatric residents in dealing with autism and recognizing autism. The impact is today, the impact is tomorrow, and the impact will go on for years. The budget needs to be passed. There needs to be adequate funding for all of human services, and most especially for autism services. Thank you.
Good morning. My name is John Markley, and I'm CEO of Centerstone of Illinois. Centerstone is located in southern Illinois. We have offices in Alton and Carterville, Illinois. We serve about 17,000 people with mental illness, substance abuse issues, and intellectual disabilities. I was asked to talk about the impact of the budget, and there's a lot going on in my head. And as I listen to what's common among us is the people that we're here to talk about are people that can't talk for themselves. It's a very vulnerable group. Whatever array or whatever types of services we're offering, we're the only people right now speaking for them. And that really is concerning. And it's become very personal. Because when you watch this happen every day, this is what's not seen in the media print. This is what's not seen in the press ops. What's happening here is we're seeing people coming to us, for instance, for psychiatric services that were not funded. And that's the number one reason people come to us is to see a psychiatrist, is what they'll tell you. And we didn't get funding for that, or at least that's not been approved in the budget yet. But that's the number one reason people come to us for. So for them to get counseling and other types of services alongside of that, it's very difficult if that funding is not there. So what we have done as an agency is we're continuing and hiring and keeping our psychiatrists in place. We have across Centerstone right now, we have about 8 psychiatrists that we're using. If we were to lose those psychiatrists, it is very, very difficult for us to recruit psychiatrists in southern Illinois, and I suspect that that's true all around Illinois. But what we're seeing is if we were now to dismantle that service, it would take years to rebuild, literally. And so we have those issues with regard to the services that we're offering to these people that come to us. We also have issues with regard to, we have a crisis center. We had a 24/7 crisis center where people that were going into the emergency room, sitting for days, sitting for hours, whatever amount of time. And now they can come to our crisis center. Somebody meets them at the door, a peer support specialist, says, hello, I've been there, let's talk about your problem. I've been there, done that. And they walk people through these things. It's been show great outcomes for these people instead of sitting in an emergency room where they're not getting any help at all. We have had to cut those hours from 24/7 to about 8 hours a day. Those services also help people that are coming out of the hospitals that reintegrate back into the community. And we're seeing that we don't have opportunity to do that either. And now, as we look at these things and we talk about the impact on the people, it just seems that we're standing before the pulpit, we're standing before the cameras, and we're talking about these things, and nobody hears. And people seem, and if you will forgive me, people seem to be governing for special interest groups and not the people of Illinois. People seem to be governing for their position and not the people of Illinois. People seem to be governing for their politics and not the people of Illinois. And I can't say strong enough, if even it was your family member, I wish that you could know the pain that we see and frankly the blood that is going to be on the sidewalks should this go on another month. It is going to be, as people talked about, a wave. This is not we didn't stand and get together and say, let's just tell them the worst so that they can get the real feel for this. You're going to see it happening. You're going to see it in your backyards. You're going to see it in your communities. And so what I think is really important here is that we don't forget the individuals that these people are serving, that we're serving, that we don't forget the families that we're serving, that we don't forget the communities that we're serving, because this has to come back to the people of Illinois, because that's who's going to see the biggest impact and have the biggest effect on this. Thank you very much.
Excuse me, sir, what do you mean by blood on the sidewalks? What do you mean by that?
Can we pull questions to the end? I'm sorry, we just have.
Just so there's a committee hearing coming up too.
Okay. Yes, good morning. My name's Polly Poskin. I'm the Executive Director of the Illinois Coalition Against Sexual Assault. It's a statewide association of 28 community-based rape crisis centers in Illinois who provide 24-hour services 7 days a week, 365 days a year to sexual assault victims. I want to thank you, Kathy, for organizing us today, and Senator Staines for your historical support of human services in this state. I'd like to begin, too, by saying that my 92-year-old uncle lives in the farmhouse that he was born in, on the family farm that continues to be farmed by his sons. And I get it about agriculture in the state of Illinois. I appreciate the agribusiness and the agricultural infrastructure that is the #1 industry in this state. An industry that depends on a state fair in Springfield and in DuQuoin to be the trumpet of that industry. Just like everybody you've heard from today are the trumpets for the industries that are happening at the local level, that provide supportive services that are not unlike that government provides, whether it be to agriculture, our #1 industry in the state, or to the needs of vulnerable people, who should be our #1 concern as a government. So I know in the rape crisis work around the state, last year in FY15, I can tell you we saw 8,908 victims in person, 1,021 significant others of those victims, and we had 9,593 anonymous contacts on the hotline. And these folks provided about 101,000 hours of service. Now, these are individuals that we contracted with the state of Illinois, and I do want to remind folks, we took a 2.25% cut the last quarter of FY15, and we're destined to take a 2.25% cut coming into FY16. And perhaps we can take a 2.25% cut and do one for the team, if that helps the state of Illinois, but we can't be zeroed out. Because if we're zeroed out, there is nobody to accompany a rape victim, who's a victim of a crime perpetrated against the state of Illinois, who is a witness to the criminal justice system, hopefully in the solving of that crime, that hopefully reduces the recidivism, that hopefully brings some justice to the victim and to the safety of our communities. We cannot be zeroed out. I did a quick survey. As Kathy said, we pulled ourselves together here as quickly as we could, and we did a survey asking, what does this potential zeroing out mean in rape crisis work? Well, our folks in Vandalia said all part-time folks would be reduced. That'd be 1 counselor, 1 educator, 1 advocate would be moved to part-time, 2 counselors would be completely laid off. Not a good thing. The folks in Urbana said, I believe we would have to lay off our part-time employee, reduce hours of at least 2 out of our 7 staff members. The folks over in Decatur said 2 FTE layoffs. Folks over in Quincy said, well, it depends on how long the delay should occur. My best guess would be 3 to 4 staff members would be laid off from the sexual assault program. Way down south, well, we're okay for the next 3 months because why? We're going to use our reserves. So this is a 501c3 not-for-profit who has to have some kind of line of credit at a bank. Not an easy thing, I can tell you, to access, and they will use that for the next 3 months. But if the budget stalemate goes longer than 3 months, then our board will have to meet. We can't afford to do this. We've contracted with the state. We've said to rape victims in our communities that these services are here to support you. We can't turn your lives around all by ourselves, but we can with all the supportive services that come into play when a rape victim reports a rape. And that would be the hospitals, that'd be the criminal justice system, our law enforcement, our prosecution. Many and not any of those, all of those. Nobody is asking police to do budget cuts. Nobody's asking prosecutors' offices to do cuts. But yet a rape victim is a witness to the crime, that those entities can't operate and solve the crimes and promote the safety of the community without the participation of that witness. So it's our responsibility, I feel, in many ways, to help that victim continue to be a part of solving the crimes and contributing to the safety of the community. And we feel it's our responsibility to them that they get the recovery and the assistance that they can possibly muster from being at a rape crisis center so they can go on to be viable members and participating taxpayers in the state of Illinois. Thank you very much.
Good morning. My name is Gary Suggs, and I serve on the board of the Illinois State Museum. The governor has proposed to close the Illinois State Museum. We believe the governor has received bad advice in this regard and respectfully urge him to reconsider that decision. The museum was founded in 1877. It has mandates for research of the state's natural and cultural resources, development and care of collections, of scientific, historic, and artistic value, and public education about the cultural and natural history and resources of Illinois. It operates 6 facilities throughout Illinois: Springfield, 2 locations, Lewiston, Chicago, Lockport, Whittington, near Wren Lake. It is accredited by the American Alliance of Museums, a testimony to its excellent programs and practices. State Museum System engages people in the discovery of the land, life, people, and art of Illinois from a long-term and statewide perspective, and is the only institution in the state to do that. In 2014, more than 386,000 individuals, including 40,000 students and 2,300 teachers, were served by the ISM, both on and off-site, and the museum system had 1,500,000 virtual visitors. The visitors to the ISM facilities and attendees at off-site museum programs and events spend about $33 to $36 million in Illinois communities each year, based on Illinois Office of Tourism estimates of visitor spending. Also, the ISM sponsors the Illinois Artisans Program, which provides an outlet for Illinois artisans to sell their products through ISM shops. During 2014, the State Museum employed some 85 people in Illinois communities. Finally, through the Illinois State Museum Society, a 501c3 not-for-profit corporation, the museum brought in approximately $2 million in additional grants and contracts, many from federal agencies. The museum has a budget of around $6.3 million for this fiscal year. If the system is closed, the governor recognizes the necessity to care for collections, and the estimate is that this process will reduce the savings to around $4.8 million. But again, that's for the fiscal year. In addition, the aforementioned visitors' dollars will be lost, including sales tax on the $33 to $36 million visitor spending and sales tax on artisan sales. The museum cares for some 13.5 million artworks, artifacts, and natural history specimens that provide tangible evidence for the cultural and natural heritage of Illinois and is shared through exhibitions and programs. Many of these items are covered under agreements between the museum and donors, some federal agencies, some Native American tribes, some individuals. Museum closure could very well trigger lawsuits and penalties against the state of Illinois for violating those agreements, which would incur legal costs and bad publicity for the state of Illinois. In a recent editorial, the State Journal Register's editors comment, throughout much of the Springfield history, the now 138-year-old Illinois State Museum has offered steady reassurance that while people and politicians come and go from the capital city, the state's natural and cultural history are worthy of preservation, study, and protection, unquote. The editorial further states, and I quote, "Preserving the Illinois history and sharing it with the people of this state has been a priority of Illinois legislators and leaders for generations. The museum's value is immeasurable. For 138 years, the Illinois State Museum has been a priority for the state through wars, economic downturns, and tough times. If leaders choose to close the museum, Illinois will invalidate decades of valuable and meaningful research and preservation work, as well as people's interest in the state's history and culture, and Illinois will be a failure in yet another front." Thank you.
Thank you. I'm Andrea Durbin. I'm the Chief Executive Officer of the Illinois Collaboration on Youth, and also your last speaker this morning. I want to thank Kathy and Senator Staines and all my colleagues for coming here today. And I want to share with you, I won't go into a lot of detail about the programs we specifically care about because you've heard about them: Teen Reach, child care, juvenile justice programs, child welfare programs, programs serving homeless youth. What I want to say instead is that the issues that affect families and communities affect children and youth. And the things that make our state work are healthy people working. I want to underestimate that, or underline that. Healthy people working. That's the foundation of our economy in Illinois. And human services makes that possible for so many, for thousands of people. You've heard that today, right? What is the path to healthy people working? It's education. It's health care. It's job security. It's physical safety and safety of our communities. And that's what my colleagues are here to tell you about today. And that's how all this is connected, right? When a couple weeks ago, I had the pleasure of meeting a young woman. She's just turned 20. She's a child ward of the state, growing up a young woman. She's going to be emancipated, if all goes well, at her 21st birthday. And normally we'd say to her, this is your last chance for the state as a parent to you, for you to take advantage of what we can offer you. We can offer you support for your education, help you get housing. But she is so worried about her future. She is so afraid that she might be homeless tomorrow, that she's foregone her education in favor of a low-paying retail job. This decision, while it makes sense, it's rational sense in the moment, it doesn't make sense for her in the long term, in the future. She will forego thousands of dollars of her earnings because she did not pursue her education at a time when she could have. It will cost her personally, it will cost the state. This young woman is replicated in hundreds of thousands of agencies across Illinois. And she is an example of kind of what we're doing as a state here. We're cutting off our nose to spite our face, right? What you heard today, people described it as a wave. Well, I'm here to tell you it's actually a tsunami that's coming. It's a tsunami that's coming the end of this month, the beginning of September. And we've tried to put little sandbags around different services, right, with lines of credit, with cash reserves, maybe a federal lawsuit here, potential bill that Senator Staines, I hope, passes to get some federal dollars funding later. Those things are sandbags around the tsunami. You can't survive a tsunami. And if our human services are wiped out, Illinois, it will take months and years to recover from it. I want to make sure that you have an opportunity to ask some questions. So I'll invite my colleagues from the hallway to come back in. Thank you all very much for your time.
Does anyone have a specific questions they'd like to ask of certain individuals? Dean?
Yeah, the one gentleman talked about blood on the sidewalk. I mean, how, do you think that people will actually have to die before the governor and the legislators act? Because we'll get a statement from the governor's office after this. It'll talk about Speaker Madigan and the lawmakers he controls have to agree to our turnaround agenda, and everything will be resolved. So that's what we're going to get. What do you think it's going to take for this to be resolved?
You know, that's what my point was, is we sit here and you'll print it, and even, print it in bold, print it in italics, do whatever you have to do. I mean, but it has to stop being a monotone background noise to them and being something that really they see what's happening. We offer life and death services. People are in the emergency rooms, people are serving, and at some point we're going to have to say, sorry, can't get there tonight. We just don't have the resources. We just don't have it. So what I mean, blood on the sidewalks is people are going to be laying bleeding, and we just have to step over them now, just to get to the people that we can help the most right now. And that's what the issue is. I'm not making this up. And I wish I could say that, I was making up. We have about 6 months or a year. We hope they settle it by then. But they're kidding themselves when I say our government is kidding themselves when they don't understand that this is affecting life and death in the people in the communities. It really is.
Can I add to that? I want to emphasize the fact that budget development for government is policy development. The continued repeating of statements in the press is politics. We're talking about policy development. We're talking about people's lives day in and day out. We need policy development. We don't need the same political statements over and over and over. And I think there's a lot of people in government that are willing to sit down and really have true conversations about this before we get to the point where we have to stop. When this gentleman talked about the communities, our communities are going to have to pick up, our little tiny communities all over the state are going to have to pick up all the droppings of this continued, repeated rhetoric that isn't helping. We need policy development. We need real budget decisions made.
Why do you think that it continues to be human service providers, social service providers who are asked to bear the burden of budget issues in the state? We've talked about cuts over the past decade, but yet again, 80% of the budget's out the door already, and you're here asking for scraps.
Well, as you mentioned, historically, that's been one of the first areas that's been cut because of the amount of money that's there. So what's happened is, and this I think is accentuated right now, because of the deletions through the years and trying to keep some kind of coverage of service, then when this happens, then it just intensifies so human service has been an easy place to go to. Frankly, it shouldn't have been, but it has been. Because you look at some of the small nonprofits, which I know most about, they will try to operate with 5 people when they've operated with 15, just because they want to keep a presence, in communities, even though it'd be a reduced number of communities. So it's become a way of life, and it's become acceptable, and now it's become damnable, actually. So that's kind of. Well, I think it's interesting you should mention this, because legislators have been saying to some human service people, well, you guys are too easy. You've been pushed around, and it's like, we're getting we're kind of getting riled here, in this, because of not only a pride issue, but also the issue, well, we just can't deliver what we say we're going to in our mission statements. So I think it has been somewhat of an easy, not kill, I don't like that word, but an easy movement to say, okay, well, we'll still have some network. We had this rumor long before Governor Rauner was elected, was that, there would be movement toward website development so that services could be provided by just a person asking a question instead of a person being in a community receiving a need, because you could operate a website at 1/10 or 100th the amount of a contract to a nonprofit. So to me, this just seems to be incrementally happening at this point. So.
Let me say something too with regard to your question. The reason that I think they go after human service agencies and the type of people that we serve is the stigma related to those services. That these people need to pull themselves up by the bootstraps, fix it. They don't respect the illness. When the illness seems to be from here up, it gets no respect. They don't respect the people that provide the services, and so they think they can wipe a number off a page and it not have any impact in your community. When really, when you eliminate services like that, it 5, 10, 7 times more it costs than the other services, like the juvenile justice system, the jails and the hospitals and all of those sort of things. I believe it's related to the stigma.
Yeah, and I want to say too, I believe it's a significant and necessary provision in a 501c3 award from the federal government that we do not support campaigns. We can't deliver 10 cents to a campaign as a not-for-profit, and we shouldn't. That should be sort of, if you will, kind of the reward of receiving state and federal funding, asking for an exemption from the federal government of paying taxes. Because make no mistake about it, many of the people in this room, or collectively with maybe some of the folks aren't in this room, as you might know, we're set to receive $300 million, right? And maybe more from the state government and more from the federal government to provide the kind of services and support that we do in our communities. For that, I don't pay property taxes in the building that we run the services out of, right? I don't pay sales taxes when I go to purchase desks or chairs or supplies or anything. So it's a trade-off we get with the federal government. And it's a necessary one, an important one. I would never want to see that change. That said, my $15 million industry can't support a campaign. And I think it's a player. I think that's a player. So I applaud the efforts to try to take, pay to play. We aren't subject to that because we can't do that. We're forbidden from that. I like that, but I do wonder sometimes if that sort of makes us sort of the last group, to be considered. We all come over to the Capitol, and we probably bother the Senator Stainses of the world far more than they wish by talking to them. We do that a lot on unrestricted money. We can't use even the salary we receive from state and federal government to come over here to access our public officials. We have to use unrestricted money to do that, and I think we should. That said, we also can't influence in a particular way that we know politics are influenced in this state and the other 49 states. So I think it's a factor. I like it that somebody says, let's stay out of the politics of it all, let's stay in the policy of it all. That's what I think we need to do as social services. I do think it gives us a little bit of a disadvantage when it comes to influencing some of the outcomes.
Public health is not generally sexy either. If I'm going to go into a senator's office and I'm going to talk about water wells, it's probably not going to be a big priority. Especially too if the county health department is competing with budgeting with the county sheriff, you know where that ends up. It's the low man on the totem pole. We also deal with some controversial issues. Nobody wants to talk about your teens coming in with an STD, or you don't want to talk about sex education in the schools from the public health department. So there is some stigma regarding that too. And when you go to do budget cuts, you look at what the local health departments have to compete with at the county level and then at the state level, I think it's there's a lot of lack of love, let me put it that way, when it comes to the issues that we have to deal with. So.
Are there any more questions? Thank you very much for enduring.
Thanks, everybody.
Thank you. Thank you very much.
Thank you, everybody, for coming.